Hello everyone, and welcome back for more Joy in Our Town. We're going to continue our discussion with Dr. John Crouch and the Good Samaritan. Hello and welcome back for more wonderful information about the Good Samaritan Health Clinic and service and mobile truck and all of those good things. You know, over the past 20 years, what are some of your greatest challenges? What have been some of the greatest challenges?
I think some of the greatest challenges, as you well know, with any kind of a ministry type thing, you're looking for people and funds. I mean, it just breaks down to, that's the very basic level. So we're always needing, in order to expand, to meet the needs that we see, and we see continuing needs even in our community, as we've just talked about with all these statistics. We see continuing needs. So the next thing is, where do we go next, and how do we get the funding to do that, and what kind of volunteers do we have? Because volunteers are very important for us, because volunteers from the churches not only supply that ministry that we talked about, that real spiritual part of the ministry, but the volunteers also help us process patients and helps to lower the cost of what it is that we're offering. So obviously the cost of health care, there is a cost to it, even if you're, especially giving it away for free. So we really have to have somebody to pay the expenses. There's the expenses of the van and the full-time staff that we do have to have, and the medicines and all the sort of diagnostic things that we do. So all of those things are kind of important. So probably the two big challenges for us is continuing to fund, especially the expansion of the problems that we're seeing, and also having volunteers to help us.
And the partnership must be really big in this area. Who are some of the biggest partners?
Well, the partners are really a number of them. They're some of the really philanthropic organizations which have actually really stepped up greatly here in the Tulsa area, but also then getting partner churches, because they bring all of those key elements that we've talked about. So we have partnerships with, St. John Health System Foundation and George Kaiser Family Foundation, Temple, a lot of the other foundations that have stepped up to help us. But we also have the church partnerships, and that's really key.
So it's not just churches, it's basically anyone who would like to be involved with
us.
Right,
we really need people who see this as a real need and want to be involved from a funding basis, or from getting their organization involved, or if they have other services to provide. Part of the whole person services is doing a lot of the other kinds of things that people need.
Have you been able to track the success?
Well, we think so, and it's always hard to do a little bit of the statistical thing. As I said, one of the things we found that early on was we were doing a lot of acute care problems, or were short problems. So we had a lot of numbers of volumes of patient visits. But then when we started moving over into chronic disease, now you're talking about sitting down with one patient and talking about 5 different medical problems. So you're not going to see as many patients that way, and you're going to be managing their medicines and giving them patient education. So the numbers are not always the reflection of what the success is. What I see as one of the great successes is we've had people who've come into the clinic, been a patient in the clinic, and then they get back on their feet, they get a job back or whatever, and become a member of the church, and then turn around and volunteer. To me, that's kind of the real definition of success, seeing that cycle completed and coming around and having former patients become volunteers.
Now, are there particular areas and towns that you're looking for church partners?
We are looking for them all over. As I mentioned, we have kind of some clinics in every part of town. We're always looking for partners that are in areas where there are the zip codes of the underserved population. And frankly, what's really important for us, and we see happening, is sometimes the churches from the south side who don't have a large population of underserved near them will then bring volunteers and help us. So we're really looking for church partnerships from the churches that don't have an immediate neighborhood issue to sort of say, would you volunteer and help us in those neighborhoods where there is a need?
So individuals come to you and say, we have an issue, we have some problems in our community. Would you be willing to come into our community and partner there? How do you do that?
We do look at that, and that's, as we said, that's our sort of 3-step process. Is this a real area of need? What about the zip code analysis and those statistics from the Lewin group and others that sort of say this is an area where there's real problems that aren't being met? But secondly is, then are there some other clinical services available that they can access? And then finally, do we have some church partners, either from the places where they already, south side and other places where they have no real need, would they be willing to help partner with us with churches in that area and say, let's do this together?
We got really excited because we saw this as an opportunity. If you're a church leader, it's a great opportunity because the medical expertise comes with it, but the churches that host it have to be the hands and feet of Christ to the people who come.
There is such a need here in this community for it that I just think it's a great blessing. It's a blessing to me. It's a blessing for our church to get to be a part of it, and it is certainly a blessing to the people who are coming in to see a doctor.
And we have an opportunity to meet people who would never come onto our campus. We have an opportunity to provide a meal in the way that we do it on a Wednesday night, that we have our prayer and share room just to try to minister to people where they're at. And I think that's a model that Jesus gave, that he met people where they're at and then encouraged them to consider the fact that he was the Messiah. And we see that as what we do with Good Samaritan.
I'm a member here at First Baptist, have been since I was about 12 years old. I love Sapulpa, I love the people here, and any way that I can reach out and minister and help, I want to do that.
We host it, and we use our facility. We kind of have the biggest parking lot, so that fit us in terms of the resources we can provide. But I think God had made available resources and his people at other churches to come along with us. And so it's just been enjoyable as a pastor to minister to people, to watch brothers and sisters in Christ from different denominations fellowship, and to laugh and to carry on in ministry.
I wasn't sure that I would I'm not a nurse, I'm certainly not a doctor, so I wasn't sure that I would be able to do anything. Well, I'm the check-in person. So all the prospective patients check in with me, and I love it.
We meet people where we're at, and then we ask them to, if they'll allow us, we ask them, would you consider thinking about who Christ is and what it means in your life? It's just an enjoyable time, and we've really been blessed by just being able to watch that unfold in God's plan and God's hand to meet the needs here in Sapulpa.
Whenever a church partners with Good Samaritan, what are some of those responsibilities?
Well, we think it's a very important relationship, and we really want to look at a church and say, is this a church that's really interested in doing something of meeting needs in their community? Quite honestly, that's been our very best church partners, is those who already have a commitment. They either have food banks or clothing banks, or they have after-school care for program for kids or whatever. Those kind of partners are really the ones we look for, and people who are getting ready to try to do those things. So we're looking for that. We actually have a form we actually ask the partner or the pastor to fill out, say this is kind of what we think will be important for you, providing a place and providing volunteers and so forth. So we, and really willing to wrap their compassion ministries around those people that come in. So we have a kind of a little bit of a form we go through. It's important for the volunteers to understand that there's a real thing about medical confidentiality of information. So we do training for them for that as well. So we kind of represent those obligations right up front, so they know this is what you're going to need to do. And we can provide the training for that, but you really need to make that kind of a commitment. And we actually like for obviously our church partners that can to help support us financially.
So the Good Samaritan, you provide. What do you provide in the partnership?
Well, what we provide is obviously the medical part of the services, and that's kind of a big chunk. And we like to get volunteer nurses and or doctors from the churches that we partner with, but not always do they have that. So we provide both doctors and nurses to help run the clinics, and we provide the medicines, and we provide the medical services and the organization, and basically all of those things that go with it. Obviously, one of our big things is maintenance of vehicles and keeping them on the road and all those things. So we provide all of that that kind of makes the mobile health care really good and effective, and they really provide that opportunity and place for us to be and really wrapping their compassion ministries around that.
How many trucks and how many locations do you actually
Well, we now have 3 different vans, but we really have 2 that are mainly functional. Our first one is kind of getting old like me, so it doesn't work quite as fast. But the other 2 are very functional. And we are in like 14 different sites around Tulsa. We're doing 54 clinics a month. In addition, we do a women's health clinic once a month. Now we're starting to do retinal screening projects. So it's a pretty busy and a lot of opportunities to be involved for people to get involved.
How many new clinics do you actually open each month?
Oh, we don't open a brand new one every month. We've opened about 3 in the last 2 or 3 months. So we've gone from about 11 sites to about 14 sites. And we're always looking for new opportunities, but we have to do it, as we mentioned before, on that kind of gradual basis, make sure all the elements are there for success. And we do that the best we can. So we always make sure we go through that process carefully. Having time with the pastors and or the associate pastors of a church that say, gee, we want something in our area, and can we be involved? And we always say, will you partner with some other churches? Because it's always better to have 2 or 3 churches partnering together. And some places we have 5 churches partnering together to do a clinic. Really, really a neat thing, because it's really, they bring all their ministries to bear on the population. We find that really successful.
I just wanted to mention, if you're a pastor or you're in ministry leadership and you wonder, will this work in my church? Let me tell you, contact Good Samaritan and speak to their leadership. They can bring out Big Sam, big giant 18-wheeler mobile unit, and while talking to your church about the concept may not generate interest, having a giant show and tell one Sunday morning like we did will spark all the interest you need, and you'll find out whether or not God's leading your church. If He's put it on your people's heart to minister, you can find out immediately whether they're in or whether they're out. And it's a great way for pastors just to present the opportunity to the church to do a walkthrough and a show and tell.
How can somebody volunteer or become involved with the Good Samaritan?
Yes. Well, we're very excited about the opportunity for people to join with us in this project. And there is, they can get to the volunteer information online, and there's like a volunteer form that they can fill out, and that's very important. For pastors, they need to kind of take a look if that's what they're interested in. They can get in touch with us also through this same information. And every year in the spring, we have a Good Samaritan Health Services Gala event where it really explains a lot of the information about what we're doing, so people who could look online and see about that come in and join with us. We particularly need volunteers that are nurses and physicians, because that's not always easy to fill that in, but it would be great to have that. Plus really other people though that volunteer, they can always help us with that a lot.
What about a nursing student or someone who's training to be a doctor? How can they be involved?
Well, the ones that are training to be doctors can come as observers, because we really can't let them do a lot, but we can often let them see some patients along with the doctors. Nursing students have been valuable because they can fill in and plug in some of the real nursing operations, take vital signs and help to process patients. So nursing students are valuable, and we do work with nursing students. So we'd love to see more of nursing students as well as nurses, and of course doctors, and then the medical students and or resident physicians who are in training can come and volunteer also. And they have license, so they can really go ahead and help us with the actual taking care of patients.
That is wonderful. Good Samaritan is doing some really wonderful works around the community, and we have you to thank for that, Dr. Crouch.
Well, you really don't. It's the good Lord you have to thank, and I'm fortunate to be able to be one that kind of gets a chance to be
his hands
involved
and feet,
in it.
exactly. Thank you so much for being a part of Joy in Our Town.
Thank you.
And if you would like more information about the Good Samaritan, be sure to check them out online or call them directly. Until next time, put a little joy in your town.
This program has been sponsored by the Trinity Broadcasting Network. Your continual support can keep Joy in Our Town brought to your home every day. So write Joy in Our Town, P.O. Box A, Santa Ana, California, 92711.